Great, Simon. Thank you for joining us today on this episode talking aged care. Simon is the managing director at Guide Healthcare. And Simon, I know that you're a physiotherapist by profession. Can you please give our listeners and our viewers a bit of background on yourself and what yourself and your company does?
Yeah, thanks, Mark, and thanks for the opportunity to talk to you today and to talk to all your listeners about what we do at Guide. So as you said, I'm a physiotherapist by trade. So my background is I started in aged care about 12 years ago. Like many of us who work in aged care, I sort of fell into aged care. I was a bit of a reluctant physio while I was at uni. Sort of my journey through uni, I didn't love my physio degree, but found my way into aged care and really developed a passion for supporting older adults. And I love the kind of unique challenges that come with being a physio within the aged care space. I started Guide about 6 years ago, and we're primarily based on sort of the eastern seaboard or along the east coast of Australia. We support older adults living in residential aged care, home care, and the disability sector. Primarily physiotherapy services, but we do provide the full suite of allied health services as well. Our I suppose passion is really about the creative design of exercise programs and trying to be innovative within the aged care and home care space. So my role is really about creating an environment where hopefully our teams can shine and we can achieve some great outcomes for the people that we support.
No, thanks, Simon. I think it's really great to watch your journey, to be honest. I love looking at your LinkedIn posts and seeing some of the videos, seeing the experiences of the residents. They love what you do. You can tell that obviously brightens up their day. And I think it's so nice to see the change in what you do. And what I mean by that is, previously I've been a facility manager. I've worked in, quality and aged care before becoming a partner in FIDM Holdings, looking after recruitment. But we can see the physios that I guess actively care, want to be there and really make that difference. And I can see in terms of the model of care that you deliver with your company and through your staff is that rehabilitation, but also meaningful engagement. They really want to be there. The residents by name, those small nuances, and that sort of really cheers them up. Can you talk to us more about the model of care and I guess that innovative kind of interactions that you do have?
Yeah, so I guess to kind of explain it fully, I suppose we have to take a bit of a jump back and really talk, I suppose, to the motivation of starting Guide. That's a bit of a theme, but I was probably a bit of a reluctant business owner as well. My motivation for starting Guide was really about trying to kind of do aged care physio a little bit differently. We're going back to the ACFI days, obviously, so 2018. And really physio was driven by these kind of 4B massage-based models. And I was just frustrated with that model, I suppose. So when I started Guide, I wanted us to be different. I wanted to create an environment where our physios can kind of come in and do the things that they loved doing, with the goal of achieving better outcomes for older people. So to try and be kind of rehab focused, as you touched on, this kind of wellness and reablement that's very much become popularized, but maybe we're not quite doing so well at the moment. It's about being goal orientated, working with individuals. So seeing the resident population not as this kind of, we're looking after the home, but looking after each individual person, and trying to dig into what's important for them. So creating goals with the people that we work with, be outcome measure driven, try and be effective, and then working within what we hope is an evidence-based framework. So rather than focusing on, for example, in 2018, it was rather than just massaging people, it was about, well, how can we effectively treat pain, or how can we help people to improve their mobility or something that's important to them around function. So whether that's, something to do with their activities of daily living, or maybe doing things like just being able to get home for Christmas. We've had some amazing stories about, where our physios have been able to work with someone to do something that's very important to them, attend a wedding, go home for Christmas, get down to the park, even get down to the beach for some fish and chips. So finding ways to kind of motivate people. And then from an allied health perspective, and certainly from a physio perspective, implementing the types of programs and doing the types of treatments. So whether that's, hands-on or exercise-based, to support that person to reach their goal. So, like in my mind, it's just quality physio. That's really what we're trying to promote.
Proper physio.
That's proper right. Physio. Yeah, exactly.
That's right.
So, that's a very long-winded way of saying we're just trying to do good physio, good allied.
No, I appreciate it, and honestly, I can cast my back to the times of ACFI, and it used to break my heart as a facility manager, going around and seeing my physios and OTs just massaging residents the whole day. And you used to pull them to the side and say, how's your day going? And they were like, so demotivated. And I was like, you did not go to university just to do this. That is not the appropriate use of a physio. And you're right, doing the right things and prescribing equipment, doing manual handling training, preventing falls. Like when there was ever a fall, we used to get our physio straight away to have a look. And there could be basic things like the relatives brought in some slippers that don't have a good grip on the ground, or it doesn't help with their gait. But like they were so switched on, and it wasn't just even things like Roho cushions. Some people think, okay, prescribe a Roho cushion, get rid of pressure sores, but it's like, have you pumped it up to the right,
Sure.
sort of. There's so many different sort of nuances, and I think we had our physios back, on the days when I was looking after facilities. We were indebted to them for, keeping the pressure sores at, grade ones with nothing, and also mobilizing people, and optimizing their quality of life, which in turn, reduces behaviors, which reduces the need to give medication, and the whole sort of, domino effect. But I wanted to get your opinion on the change in the funding model from ACFI to ANACC and how that's impacted allied health professionals from a RAC perspective.
Sure. Yeah, we've got to cast our mind back, don't we? Feels
That's
like
right.
ANACC is just the new normal now. But
That's right.
yeah. So in general, look, I think it's a good change. I think we all knew the limitations of ACFI. Certainly, sort of these perverse incentives around rewarding disability. Obviously, it was very prescriptive. Sort of the documentation requirements around it were obviously really, really high, which saw us, both allied health professionals, nurses and care staff spending so much time just trying to support the funding so that when they're externally assessed, homes were holding on to that funding that they'd claimed. So obviously a bit of a nightmare, and from a physio perspective, limiting us to things like massage and use of TENS machines and applying heat packs was very, very frustrating, as you've touched on, and very demotivating. And it saw a lot of really good physios move out of the space.
Yeah, that's right.
Yeah, really,
Unfortunately,
for sure. And it took that real creativity and from a clinical perspective, it took away a lot of skills. And you touched on the fact that we don't go to uni to be massage therapists, and that's exactly right.
that's right.
It's funny. The timing of this conversation is interesting because I was talking to somebody only recently who referred to the 4B claim as the Rolls Royce item within ACFI, which was I couldn't believe that that was the reference. But just in terms of the ability for that 4B to kind of drive funding outcomes. So the fact that we've seen the back of it, for me, is very, very exciting. And the other part of it as well, I suppose, as far as frustration around ACFI and 4Bs in particular, is this idea that we kind of umbrellaed physio and OT in particular under the same thing, same umbrella. We sort of lost the definition of what a physio and an OT is or does, and particularly the differences between them and the important differences, and kind of diminished the skill sets between the two. So it's good that it's gone. So from an ANACC perspective, I certainly think it's a better system. If I put my kind of impartial hat on, I do like the fact that it's an external assessment process. I think it just takes that load off. However, I'm not sure it is being executed as effectively as it could be at this stage. So that's obviously a little bit frustrating for providers, this constant need to kind of reassess and make sure that the residents' funding is meeting their actual care needs. So we probably need to be better there. But obviously like the fact that there's no disincentive to make people better. So from a physiotherapy perspective, if we're supporting people to improve their functional abilities and mobility, there certainly shouldn't be any reduction. Well, there won't be a reduction in funding. So that's awesome. And obviously no punishment for reassessment. So again, important. But obviously there's no funding for allied health. There's no funding for physio. And that obviously sucks. And if I think back to my journey with guides, so in 2018, we obviously knew the new funding tool was coming. We kind of we were going to do it this way anyway, but I would say that we took a bit of a gamble or an educated position maybe, or around making sure that we weren't 4B focused. And our hope that was when ANACC was announced, we knew it was coming. We didn't know what it was going to look like. But my hope was that when the new funding tool landed, it obviously prioritized allied health. Now that hasn't happened, as we know. So from our perspective, it's very, very disappointing. However, we do know that the feedback from the Department of Health is that allied health has been built in to the funding, and there's certainly an expectation that allied health services are going to be delivered. We can talk about the reduction in physio hours from ACFI to ANACC. We know that's occurred, 50+%. But in general, I think ANACC is a positive, and I'm happy that it has changed from ACFI for sure.
No, that's right. I mean, I guess obviously you did touch the frustrations in terms of physios, OTs, massaging the whole day, the way that it was described, and I think it was just I think if family members knew how facilities got their funding, or so I don't think they'd be too happy. So it was great if, for example, Mr. Joe Bloggs couldn't cut up their food, or needed assistance to have a shower or go from the chair to the bed. So that was great. But I think that's not what they would like to hear in terms of that wellness model and rehabilitative model. But also, it's also pleasing to see in terms of the growth of your company. And what I mean by that is, you've been in the sector for 12 years, and not saying that I'm, have a problem with physios who do this, but also I find it a bit strange. But you get some physios who are new grads, and then they start their own company in NDIS, and then you look on their website and it goes really experienced. I'm thinking, yeah, you're still out of the ropes. Like you just passed, and it's sort of unfortunately putting a negative connotation, more so in the disability side. So you'll see that a lot. I mean, there's been a massive crackdown with the NDIS and certain providers that shouldn't be there. But I think the fact that obviously you've had that grounding, you've had a diverse, dynamic exposure to different settings, and then you start up your company, you're able to mentor and guide the future allied health professionals that you take onto your team, as opposed to, and again, I'm not being, ageist or anything, but you're not just a new grad with your mate trying to do something. If that makes sense.
Yes, look, I can see this from a number of perspectives, right? So I would say my experience in aged care is actually I moved into relatively senior positions very, very quickly, and I think that was probably because there was a bit of a lack of kind of leadership, and there wasn't a stack of physios that wanting to move into the aged care space. And I would say that I essentially worked to build a business before I started Guide, and I was kind of an operations manager and had very senior sounding titles very, very early, so I can kind of relate. But it wasn't so much necessarily that I was chasing it, but I kind of had a passion for what I was doing. We would do like the approach to physio and aged care was a little bit different, and then I found my way into a business where I traveled through relatively quickly. And I think, just speaking in general, certainly from an aged care perspective, I think we're seeing now a much stronger leadership. We're seeing more physios come into the space. We're seeing some really passionate people who are, I guess, showcasing what good aged care physio looks like. So I love all of that. And I do look. I take your point around kind of younger physios taking it on, but I've also seen some incredible stories of younger physios who've come relatively out of uni, who have built incredible businesses, and maybe their ability to identify where their experience is lacking or their knowledge is lacking. If they're able to kind of identify those areas and either work on them or bring people in who can bring that extra layer of experience, I think fair play to those people for, I guess, taking the risk, because starting a business is scary, as you would know, and
Get some great
but
hair.
there's also I'm losing mine. Have been for many years, but I do have a great deal of respect for that as well, just in terms, and I'm sure you do as well, but just in terms of the bravery and the work ethic, and the kind of ingenuity and the things that it takes to kind of build a successful business. So I definitely take your point, but I'm almost a little bit more on the side of almost fair play, and I hope that people who do take on that challenge of running a business, if they're able to kind of reflect and self-identify where they may need support, by bringing people on, I think they can create really successful businesses. And what I do love about younger people running businesses as well, like if I look back 6 years ago when I started Guide, and I was maybe only 6 years or so out of uni, I think my approach to business and my focus on the importance of educating staff, being creative, creating a place where people want to work, like this real focus on culture and creating a great environment for people to work. I hope that has meant that many people, many physios and other allied health staff who have come through Guide have maybe benefited from the fact that, maybe I was a younger business owner or leader. So I don't know, there's kind of checks and balances, right? I think there's positives and negatives on both sides.
No, I agree. And like, to be fair as well, I know, for example, some colleagues, and not, I guess, painting in just in a negative connotation, but some colleagues who new grads from uni, but they had a passion during university during their placements for rehabilitation wards for stroke victims. So they've literally got a niche business where they just deal with rehab and stroke patients. Amazing.
Nice.
And they get specialists in, and so it can be done. And yeah, like we just said, kudos to people who go out and do it, because it's not fun when the chips are down and you have to wear 10 different caps. So I think like you said, it's great to see there are more physios, more OTs coming into the sector and giving it a crack. I think. Well, what's your sort of thoughts in terms of where do you see the role of allied health professionals in retirement living versus aged care? And do you see retirement living being the next aged care in terms of aging in place?
Yeah, so I suppose there's two parts to that, right? So in terms of, do I see aged care being starting to that aging in place? We are obviously seeing these kind of new and innovative models. I think my mind goes to kind of your LDK type businesses, that sort of creating these environments where it's much more aging in place in real terms. People are actually receiving the care that they may ordinarily access within an aged care home within their actual apartment or home. And I think that's great. I've been fortunate enough to work in a couple of the LDK homes, and to see what they're able to achieve there is really, really incredible. Love the model. What I would say is there does still seem to be potentially a bit of a gap between kind of the haves and the have-nots, particularly within that model. But can it be done potentially on a not smaller scale necessarily, but maybe a budget? I think probably yes, and something that could certainly be explored. It's probably not something that I've spent a huge amount of time considering, but yeah, in terms of the retirement living space, I look at things more from an allied health perspective. So if I think about the people that we see within our home care setting, I think allied health is probably something that's still not being prioritised. If we look at the Royal Commission, there's sort of a 2% spend on allied health services, or 2% of budgets were being spent on allied health. And for me, that is a concern, particularly when we think about this idea of, we want to keep people at home for longer, right? And people want to stay at home for longer as well.
That's right.
Again, this is such a broad conversation, but if we think about in terms of mental health within the residential aged care space, and you only have to spend a few days in aged care to realize that people really do want to be at home. So as a physio, I really want to be keeping people at home. So if I look at what changes I'd love to see, I'd love to see a more proactive approach to where we're actually, or how we're supporting people. So rather than referring to a physio once somebody has a fall or an acute health event, this idea of kind of keeping people well for longer. So aging well as opposed to aging long. So not keeping people alive for long periods, but keeping people well for long periods of time. So the goal is, maintaining function, keeping people healthy and happy as opposed to just longevity. So I'd love to see a sort of shift towards that. And, I know there's some significant changes on the horizon around home care. And I think that's obviously going to permeate within the retirement living space, because lots of people within retirement living obviously accessing this type of funding. So it'll be interesting to see how this kind of change towards allocating funding towards services impacts how long people are actually staying at home, and hopefully moving away from this kind of do for model, and moving more towards that re-ablement model where we're actually doing things with people, where we're finding ways of promoting wellness and function. So I don't know if you've answered your question, but how does that impact aged care? Well, then I suppose it means that people are actually staying at home for longer, and people are entering the aged care space with higher care needs and lower functional abilities, which is kind of what we're seeing already. But yeah, I mean, I don't know. It's a big conversation, I suppose. I don't know if I'll answer your question well, but
no, correct. I think you're right. I think you just made the point there, and you're spot on that ideally the government, everyone wants people to stay at home for as long as possible. And you just touched on mental health, familiarity, doing things they normally like doing. And there's such a big focus. I think it's hard with home care in terms of the regulation perspective. I think that's where the difficulty is, like where it's not. I think compliance can be interpreted a bit better. But you're right, I think in terms of, you can see the effects of people living at home and how that impacts on their behavior and dietary intake, etc. But I think you're right, aged care is sort of heading towards, like you've mentioned, retirement living, and And I think it's important to say, and obviously while we do have a positive focus, it's good to discuss, I guess, those curly issues, because potentially if enough people make enough noise about a certain topic, you would hope that the powers that would be, it would not be changed. But you're right, when it comes down to retirement living or even the LDK model, which is a great model, it's also, I guess, a type of socioeconomic class that benefit from that. So it's like, if I wanted to have physio every day, I can. I'll pay for it, but I'll have that. Whereas if I was in a residential aged care facility, I might get an assessment, and it might be a case of having to have an event, a fall for that to occur. And I guess I actually studied physio back in college before university, hoping to get into it. And then when I saw the amount of Latin involved in the muscular sort of side, I thought I'd better step away now. It's a bit much for me, a bit hard to take on. But I do remember, obviously, the best form of cure is prevention. So I totally agree in terms of like you said, getting them on board, getting physios, getting OTs on board initially, looking at preventive strategies, looking at that enablement model. I definitely think that's really important. So,
and I'd say, Mark, just in the interest of kind of while we're on this topic, and it's maybe not super specific to aged care, but what I would encourage people to start to think about is having these types of conversations with their older parents, friends, neighbors now, in terms of what are they actually doing to kind of maintain their physical capacity now, because it's the sort of thing that we don't really think about until it's kind of too late, potentially, and while an older person may be fine with still getting on the bus and going up to the shops and able to get their shopping, albeit with the help of a four-wheel walker and maybe a support person. It's when that kind of first fall that happens that tends to lead to this kind of rapid deterioration. And we know we know the impact of things like fractured hips, for example. But you can have these types of conversations with people now. So, for example, like my parents are in their mid to late 60s. My mum has had rheumatoid arthritis since she was 11. So lots of joint degeneration, hip replacements and what have you. But I was at the dinner with mum and dad recently, and obviously super fun having a son as a physio. You get stuck on all the great topics. And I was like, when was the last time you guys got down on the floor, for example? And mum and dad were like, well, mum in particular was like, I just can't remember, more than 10 years. But the ability to kind of get down on all fours, take weight, move up onto one knee, push up into standing, even with the support, able to take, to feel what it's like to kind of take weight through your wrists and hands and elbows and shoulders. These are things that would actually set mum up, very, very well if she had a fall, that strength in the upper body, that kind of functional position. So anyway, to cut a very long story short, the next day she's sending me videos of her getting up and down off the floor, and apparently this is part of her regular routine now. So fair play, mum. But my point being that essentially this is kind of preventative. It's proactive. It's things that don't necessarily need weekly physio, but to have kind of a one-off, maybe a chat with the physio, or maybe talk to somebody who's a little bit more experienced in exercise, or even just do a bit of Googling, to be fair, do a bit of YouTubing, and you can find some cool stuff. But anyway, I think as a society, and again, we're covering a lot of ground, I think what we want to be doing is looking at healthy habits and being proactive very, very early, and by the time you get to 70s, 80s and 90s, hopefully you're in a much better position.
You're right though. I think especially I think statistically, once you pass the age of 30, you start to lose muscle mass and flexibility if you don't utilize in different parts of your body. And you're spot on. I think.
Don't tell me that, Mark. I'm 35 now, so.
Yeah, I'm a few years ahead. 38 this year, so I'm starting to feel it. But it's true what you're saying. I remember the days of playing, semi-pro cricket. They feel like a long time ago. Don't have the match fitness to play on the PlayStation now, but I remember those days. And you're right. If you don't do the preventive, you don't do your stretches. The worst thing is when we saw the physio and they were doing things like hip flexors, because it feels like you're going to die. But you're right though, just that flexibility, that stretching. But even I think it's an engagement piece. I think the role of allied health professionals, especially in an aged care facility, you're often that ear. You'll often hear something where a relative, would say something to you, or one of the residents would say, hey, Simon, this has happened, or they'll confide in you. So you'll find that often your primary purpose potentially on rehabilitation, or you're trying to get them to move from, to assisted one, you would uncover a lot of things. And I think in that aspect, you wear a lot of different hats. And that's why it's so important to make sure that when we do have staff, that they feel part of the team, they're included. They don't have this kind of, oh, we're a contractor, or we report to head office. No, they're part of the team. And I think again, a lot of things can be prevented from good communication within the team.
No doubt. Yeah, no, I think, one of the things I know that we spoke about when we caught up was thinking about, what does make an effective allied health professional within the aged care space. And I think communication was one of the things that when I was sort of reflecting on it is going to sit very, very highly. And I love the fact that you kind of point out, you obviously know the nature or the nature of our business and our service delivery being an external provider. And yeah, the risk is that, we walk in with a different t-shirt and all of a sudden we kind of not included as part of the team. But where I think it works very well is looking at that integration. So for us as a business and supporting our team members, we do a lot of work to make sure that, within the home, the facility managers and care managers and staff know that, yeah, we wear a different shirt, but we're part of your team. And communication from our side, but also from our clinicians, plays a big role in that. And I think as businesses, we should be focusing on that. So not just developing skills around, how to prevent falls, how do we provide good exercise programs, but also how do we build more effective, I guess, people and workers as well, and communication playing a huge role. But I don't know, do you want me to touch on a few other areas that might be good areas as far as key attributes or good skills that allied health?
Yeah, definitely. I think one thing that's I guess I've seen recently that's come across your socials, and I know it's sort of hard to condense that much allied health in a short segment on this podcast, but I've seen deliveries of rowing machines to facilities. I've also seen the Olympic signs. Can you talk to us? I think it's fantastic. Can you talk to us about this innovative sort of innovation that you've done with the Paralympics? Can you give us our audience a bit of a rundown of what that's about and how their facilities can still be a part of it if there's time?
Sure. Yeah. So it's been kind of nice because this has almost been reflective in terms of sort of how do we end up here and what Guide's about and sort of, my motivation for starting Guide and obviously still running it. And so when I started Guide, one of the things I really wanted to do was create these things called like cross-site events. So essentially find opportunities to kind of build community across homes and across organizations and find ways to kind of connect residents in a way that was still very physio focused, but very kind of motivating and empowering and fun, to be honest as well. So yeah, the Powerlympics is the latest in our cross-site event. It actually kicks off on the 29th, which depending on when this comes out, is probably the Monday coming. And the Powerlympics is basically 4 power-based events that we've designed to kind of that residents can participate in and compete as individuals and for their home against residents from sort of right across Australia. So they'll be competing in weightlifting, in rowing, in cycling, and in long jump. Everyone gets a little bit scared when we say long jump, but there is ways that we can get people to do that.
Nice.
But essentially, so for all of our partner homes that we work with, we always donate the equipment that's needed. So if we're going to design these events, we want to make sure that all the homes that we support can participate. So we've been sending out rowing machines and spare sets of pedals so that the residents can participate. And our goal with all of these events is to cater for all levels of ability. So think kind of more like Paralympics than Olympics. So we have different classifications within each event. So for example, weightlifting, different weight categories and different ways of lifting that weight. Within the cycling, we have an upper limb and a lower limb cycle. So people with low mobility, for example, but still have good upper limb function can take part. So it's really about designing
all inclusive, right?
Oh, absolutely, yeah. And it's not. I guess the risk within aged care and what we see a lot from a physio perspective is this catering to all levels of ability in the one. Well, basically, we're catering to the lowest level of ability and kind of bringing everyone down to that level. Whereas our goal with these events is to create events that not only cater for people with lower levels of functional ability, but also to the people with super high levels of functional ability. And that's where something like a long jump becomes really interesting. And we get some incredible results. So we ran this event, a similar one back in 2021. we uncovered a 100-year-old weightlifter from Wollongong. That's not a
Oh
line.
wow,
That is a real. That is a real. It just rolls off so nicely.
that's
But
right.
yeah, so 100-year-old weightlifter from Wollongong. We have residents doing deadlifts, stacks of deadlifts in 30 seconds. We've got like 9-year-olds participating in rowing and cycling. So the way we run it, it's 4 weeks of competition. We have a live leaderboard on our website. We actually put all the resources out there for free, so any homes can actually take part. Unfortunately, we don't have the capacity to donate rowing machines to every home who takes part, but if you've got a rowing machine, that's awesome. Or if you're happy to
Nice.
donate to buy one for your home, certainly do that.
Yes.
But yeah, I mean, weightlifting, from Kmart, a couple of kettlebells, pretty cheap. Very cheap pedals from Kmart as well. The long jump you can do with essentially no equipment at all. But we'll send you out all the training resources. We'll hook you into the leaderboard so you can upload your teams and start putting scores in place. It runs for 4 weeks. And then on the 5th week, very fun event where we do a week of live streamed competition. So Monday might be long jump, Tuesday will be weightlifting. You get the idea. And we essentially zoom into all of the homes. A lot of our homes do an incredible job at setting up like stadium type scenarios where they've got a stack of residents watching. Yeah. And then we'll ask that you send in who your competitors are. So, we'll have 5 or 6 different long jumpers and weightlifters and what have you. And the cool thing is we then get an opportunity after we sort of, have heat 1 of the rowing. I get to then jump out and sort of have a chat to, from David from Deniliquin and, Wendy from Wollongong and all these residents and catch up with them and find out, how their 4 weeks of competition went and what their training was like and how much they've enjoyed the event. So anyway, a lot of fun and anyone can sign up.
Nice. And look, before I proceed to my next question, I think we'll all want to know how does the long jump work with the residents? So how does that work?
Yeah, so look, we recommend parallel bars. They're a good idea. This is something else that we always donate. However, as long as you've got support. So we do put some ideas around how you can support people to take that on. So it can start off with as simple as taking a long step. So holding on to something, so rail on one side, maybe a chair or a support person on the other side, practicing taking a long step. That can progress to trying a little bit of a jump. So holding on with bilateral supports, taking a little bit of a jump. If you have a look at some of the videos we've released, it kind of progresses to residents getting the confidence to kind of take weight through both of their upper limbs. Again, parallel bars are great for something like this. And yeah, we had one resident who was a above knee amputee, and during the live streamed events, he must have done about 2.5, 3 meters with the support. He really just went for it on this live stream event. And we did actually have a few staff sort of making sure that he was supported and he did need that support. Let's just call a spade a spade.
Yes.
I nearly had a heart attack, to be honest. But we're massive on kind of this idea of dignity of risk, right?
Yeah, great.
And this idea that, if residents want to take on these challenges, our goal is to set them up to be safe and supported. So rather than saying you can't do this because you have an above knee amputation, it's about no, you want to participate, you want to take this on. Do you know what? In hindsight, we should have basically just had the amputee category because he would have absolutely dominated. So we might have to bring in some new categories of this one. But yeah, it's really just about setting things up to be safe and obviously empowering residents to kind of take on these challenges. But yeah, I mean, look, again, I'd encourage any homes that are participating that aren't partners of Guide, work with your allied health professionals, make sure you've got physios there designing how you might be able to extend or to progress people through the stages of being able to go from a step to a long step to a small jump to a longer jump, to a bilateral support to a single support, and maybe even to a no support, which is one of the categories. So it's doable. Certainly you don't want to go from, hey, I haven't jumped in 25 years to taking on a jump overnight. But yeah, there is ways that we can progress people through the stages.
That's great to hear. It's also great to hear. Thanks, Simon. It's also great to hear that you talked about dignity of risk. And a lot of the times, some staff aren't aware of what dignity of risk is. Look back to accreditation and, felt sorry for this RA when she was asked what dignity of risk was, and she gave the definition of privacy and dignity. But the fact that you're allowing people to make safe risks, to make those choices, and you know what, if they do, have a mishap or a fall, you've got the risk assessments in place. that's
Yep.
allowing them to live their life. You're optimizing their quality of life. So I think that's great. I think, yeah, that's really, really cool. I was also going to ask you, like, I mean, slightly different topic, but I wanted to ask you, and you would know this as well, being in the sector, what would be some like common misconceptions that people have about the role of allied health professionals in aged care that you'd like to address?
Yeah, so a few things come to mind. I think the first one is just understanding what allied health is. So understanding that allied health sort of encompasses this broad range of health professionals who are sort of mostly are all registered under under APRA, and so just understanding that a physio is different from an OT, and really recognizing that the role of allied health is this multidisciplinary approach whereby you've got different professionals, university qualified, who are all coming together to kind of work towards a common goal. So I think there's a gap in knowledge, particularly in the aged care space, around knowing that a physio and an OT are different. We can come together to achieve a common goal, but it's really important that we recognise the valuable skills and approaches that separate each other. I also want to break down the misconception that aged care is boring. So,
I've seen your videos. It's far from boring. I've seen your videos.
It's far from boring. Yeah, exactly.
Correct, yeah.
So, and this misconception that obviously physios are just massaging. Like, I'm focusing on physio because obviously, I'm a physio. And,
that's right.
For the most part, that's my real passion. But yeah, it's not boring. We're not just massaging and providing heat packs to people, and that's one of the best things from an allied health perspective that's come out of ANACC. So sure, we don't have direct funding, but the great thing is essentially the shackles are off. We now have the freedom to implement these reablement models, to focus on achieving people's goals, and you're only then really limited by your own creativity and your own ability to motivate the person that you're working with. So aged care is certainly not boring. It's awesome that we have the ability to kind of work with people for long periods of time, for multiple days in a row. It's really about how you set up your physiotherapy program, how you work with your home or the organizations that you're working with. And you really need to find someone that aligns with your own, I guess, approach and passion for physio in aged care.
Yeah, nice.
Yeah, they're probably the big ones. And the only other misconception I think I'd like to talk about is just in terms of the people that we're working with. So this idea that older people are kind of fragile and slow and boring, and like if you look at how older people are perceived in the media in terms of kind of being forgetful and and slow and whatever, that's frustrating for me. We always talk about older people at Guide as being superhumans. For anyone who's seen, you would have seen it, the London Paralympics advert.
Yes,
from it's so cool. I think it was 2012, and they ran this like, such a good, if you want to YouTube London Paralympics, I think it's like an advert, and you'll see this like cool kind of reinvention of what the Paralympics was about. It's about like incredible feats of strength and endurance and passion. And anyway, so we've kind of taken that concept at Guide, and what we encourage our teams to think about older people as these people who like overcome incredible challenges, who have this great inner strength, but also this great ability to improve physically. And it's really about us as health professionals and our ability to sort of create an environment or create a scenario we can support people to achieve the things that they want to achieve. So it might be very small steps at a time, it might be very small incremental improvements, but the ability for older people to improve is there. And we need to make sure that we're not kind of buying into this ageist view of older people as I said, being slow, boring, fragile, incapacitated, which isn't to say that, some of the people that we are working with do have things that we need to be aware of, that cause fragility or they've developed it over a period of time. But we work with such a broad range of people within the residential aged care space. Like if you've got a home with 100 people, you've got lots and lots of different, presentations and physical abilities and things like that. So, and cognitive ability. So again, just want to break down that misconception that, aged care and the people that we're working with are kind of all bucketed into this very small umbrella of what maybe society can look like, or as health professionals, we kind of presume people are in terms of physical and cognitive function and physical. Yeah, hopefully that makes sense.
No, it does. I appreciate your view. Also appreciate your view, and also your evidence-based story with your parents as well. And I think you're right there. But how many times that I don't know, for example, my kids want to do something, I say, oh no, daddy's too old for that. And it's like, no, you're not.
Yeah.
Like, you need to be
I
more
love
active.
that.
You need to be, you're not too old. And I remember when I was looking after one facility, we had one patient, and unfortunately they were diagnosed with terminal cancer end stage,
Right.
but they were well enough and they had a bucket list. And he said to me, Mark, I want to do a skydive.
Yep.
And I said to him, I want to have a good resting blood pressure. And then he laughed and he goes, I really want to do it. So we put everything in place, and it was great. He did it. He loved it. He did another one. And it was just amazing, like amazing to see. And he came and sort of did this sort of delivering speech to his fellow colleagues, his residents, and they were like, just, yeah, wow. It was just sort of this,
right?
yeah, pivotal moment where they thought we can achieve something, we can do something. So I think that's amazing. And in terms of what's around now, like leading to the next one, which is, what are your thoughts on tech? And everyone's talking about AI, and ChatGPT, and technology. What do you think the role in technology will play in allied health and aged care for the futures to come?
Yeah, cool. Let me let me answer that in just a second, but I will just say I love what you've said there around, like, not, you said, I'm too old, right? And I think we can play into that stereotype, and I think the fact you pointed that out is really important, and I'd encourage people to not, to try not to do that. As aged care professionals, but I loved also you spoke about this kind of empowering and inspiring and the impact that can have. And to be honest, I know that's what we'll see out of the Powerlympics. I know we'll create scenarios where residents who are living in aged care, people will see the effort of Joan and of Bob and other residents within their home, and that does always inspire and empower people to do it. So, and that's really what these events, it's part of what they're about. It's about creating this environment where people can shine, but also inspire and empower each other. Like, to see 90-year-old David, and I hear these stories all the time where they'll say, have you seen David, doing the weightlifting or whatever? And then next thing you know, you've got other people doing it. So anyway, to facilitate these opportunities is really cool. So yeah, and I love that story. So in terms of technology, look, I'm not a massive technology guy. So mostly what we've done at Guide has always been low tech. So we've always tried to almost take the idea of something that could be tech based and then work out how we can implement it on a wider scale without the need for expensive pieces of equipment. And things like our marathon events come to mind, where rather than having things like pedometers or smartwatches, we're able to track distances by essentially measuring tracks within the home and using, almost just like a score sheet to tick off that, that resident has done a 200-meter lap 3 or 4 times throughout that day. However, I do think if we can see this kind of incorporation of technology within the aged care space, it would be amazing. So, like, most people under, let's go 50 maybe, have all wearing smartwatches. I know whether I've had a good sleep or a bad sleep. I know what my heart rate is, where my VO2 max is going. To think of how that may be incorporated into aged care, to look at how people, how residents are traveling throughout the day, the ability to impact things like falls levels and mobility levels, and how we can proactively impact care and looking at rapid responses to acute events and things. I think, wouldn't that be amazing? And from a physio perspective, it's really going to help me to see how hard I could potentially push people a little bit further, or when to push, when to hold back. I think certainly that's important. But yeah, and then you've obviously got things like VR. VR I think is being popularized, but at the moment it's being popularized as experiences, and
correct,
take you on a journey.
That's right.
To see that incorporated into more exercise-based programs. I think the ability to use these types of equipment around exergaming type scenarios would be amazing. So we're not seeing a lot of that just yet. But also, we are seeing some great concepts around, things like falls prevention equipment, and tech is just so broad, right? So looking at sensors and monitoring systems that aren't invasive, all these things are really exciting. And I think in terms of the goals that we're trying to achieve in aged care around improving wellness and preventing falls and things, I think there's such a wide scope, and I think we're going to see a greater implementation around those things. And do you know what, Mark? I had one more point. I think it was a good one, but do you reckon I can remember? Maybe it'll come back. Maybe it'll come back to me.
That'll probably be the second segment when we get you back. So I think I actually like what you've said, and I really like what you said when in terms of if something is technical, you break it down, because you're then knowing your audience, your demographic, and the demographic of people we work with. They're not into the smartwatches or using this tech in a way to interpret what they're doing. They actually would like to, if they're able to, keep score of their fellow resident, what they're doing, or so that's again aligned to providing good care, quality care, appropriate to the demographic you're looking after. So I think it's spot on, and I think yeah, I'm really excited. I almost feel like, and there are a lot of companies out there offering physio, OT. And some might have dietitians as well, etc. But I really feel, but I'm pretty sort of, glued onto what you guys are doing, because I really do think that you're sort of raising the bar, and you're really coming up with emerging ways to engage the population. So I'm sort of excited to see what the next few years and beyond holds for Guide. Yeah, really keen to see what you have sort of up your sleeve.
I appreciate that, and I think yeah. Look, our focus has always been on us. It's what we can do. Trying to control the things that we can control. I'm big when I talk to our team about we're always solutions focused. So as much as we face a lot of obstacles, the funding maybe isn't there, and we're working with people who have a lot of comorbidities and challenges. But our goal is always like time is always an issue. Do we have enough time? Do we have access to equipment? There's all these things. So if we focus on just the challenges in aged care, as in things that stop us from being effective, then we're never going to achieve the sorts of outcomes that we want to. So yeah, certainly at Guide, our goal is to always be solutions focused, and being solutions focused, it's for us, it's about being creative. So, we may not have access to the best or most up-to-date technology, but we might be able to find a way to recreate it in a low-tech sense, which will mean that we can push it out to more people. So there's always ways to kind of overcome these challenges. And that's the thing, to be honest, that I really love. I love, trying to be creative and look for ways of doing things differently and better. And we're constantly pushing ourselves to be better. So yeah, it's always cool to hear that people have been following our journey. And yeah, I appreciate you saying that, you're keen to see what we're up to. And I feel like you're a bit invested in what we do and our success. So that's pretty special.
Definitely. I think, for us as well, like, it's important, whilst, we recruit for all roles in aged care, that's not allied health, but it's important that there are a lot of times that organizations will ask us, do you have an allied health arm? Do you have candidates, or do you have a preferred company? But it leads us to, and this is not a paid partnership by Guide, by the way, just to say to the audience, but it leads us to say that we do want to encourage you guys and sort of recommend you, because I think for us, I've been following your journey for quite a few years, that the proof's in the pudding. I also remember, and this is completely separate, but I remember there was a struggling facility in Victoria, and I think you went out there and delivered some training to the staff at a very, very reduced rate that you wouldn't do for a town in the middle of the sticks. But that just shows your passion for the sector, and it shows that you wear your heart on your sleeve. So really pleased to see what you're doing, what the years sort of what sort of happens in the years to come. Yeah.
Yeah, I appreciate it. I can't believe you remember that, but yeah, I mean, we're purpose driven, and we're just looking to create an impact. So, it's fun to share our journey, and it's cool to hear that you've been following it. So yeah, I appreciate it. But yeah, we're not paying for anything.
Yeah, that's right. Correct. So, I was going to ask you, lastly, Simon, if you could just let I guess the audience know, for anyone who's looking to get into aged care and to work as a physio or as an OT, can you share some pearls of wisdom in terms of why you think they should be there? And I guess it's a two-part question, but that is, and the other part is, what would you tell your younger self who was, just started in aged care as a physio? So I guess what would you say to people who are looking to get into aged care, and what would you tell your younger self who's just started in the aged care sector?
Yeah. Okay. So what would someone's looking to get into the sector? So I think the major things that separate aged care from an allied health perspective, the major things that separate allied health and aged care, I love the fact that we essentially are working within the person's home. So whether we're in the aged care or the home care space, we are going into people's homes. We're not going into, say, a clinical environment. And so the great thing about that is, I think you get to be yourself. I love that. I get to turn up as me, and I get to build relationships with people. I get to spend a significant amount of time working with that person. I'm not limited by the fact that somebody's coming in to see me for a 20-minute appointment, or I have this goal of getting somebody to go home in 3 days or 3 weeks or whatever. There's no pressure. It's about me trying to work with that person to achieve the best possible outcomes. Now, the way I do that, I think, you need to find ways to motivate people. And that can be really, really tough. So the old "I'm too old," which we touched on, obviously that's a big one. Certainly, I'm too old to exercise. I hear that a lot. So we have to find ways to paint exercise in different lights. But really, I think the best way that you can motivate somebody is to build that rapport, to be yourself, to build relationships. And if you do that, and I find I do that through trying to be energetic and fun and, almost loud. And, sometimes I come home and I'm exhausted because I've given everything. And that doesn't necessarily have to mean that doesn't need to be everyone's approach. I think that authentic approach and the ability to build, relationships with people, you can do that in many, many different ways. But the idea that you can go in and be yourself and you can create this great impact over a period of time is just really, really special. So I think that's something to keep in mind. And I genuinely think you're only really limited by your own kind of creativity and your own passion. So the homes that we see the physios and the OTs that we see that create incredible outcomes are always the ones that are just super motivated and passionate. So I think you need to have that motivation and passion. And I'd also encourage allied health professionals to find a place where they feel like they can be the best version of themselves, like where they can succeed. So whether that be as somewhere like Guide, or whether that be working internally for an organization, so home care and aged care, I think you just need to find somewhere where you go in and you're like, I'm learning, I'm supported, I have freedom, I have autonomy, I have access to equipment and resources. You got to make sure that it's ticking all these boxes, because if that doesn't happen, you're going to very quickly either be, unmotivated or not feel that you're having the impact that you want to, and that can be very, very frustrating. So there are probably a few good things to keep in mind and tick. And if I was going to speak to my younger self, what would I say? Maybe go and study business. Might be a good place to start instead of physio. No, look, excuse me, I'm losing my AirPods. What would I say? If I was saying, like, I think, look, I'm pretty proud of the journey that I've been on. So if it was advice of how to, I don't think I would tell myself to do anything differently. If I'm being honest, I think I was extremely fortunate. My first ever role, which was, my motivation was that it was a 5-minute walk from the beach. So that can tell you where my head was at the time. But I fell into a role with a great physio space and a great organization. So I can give Warrigal a shout out. Hopefully they're still a client of ours now. But that was my first ever physio job. And they just supported me as a 22-year-old that was full of passion. So I'm incredibly grateful for them. And also I had 3 amazing physio aides who basically every Monday when I'd come in with some crazy idea that we we're going to try and implement, they just made sure that we got it done. So I was super lucky in that sense. But yeah, I think, I don't know. I honestly don't know if I'd tell myself to do anything differently. I think my approach has always been around like trying to do the right thing and making sure that we're trying to create an impact. And the idea that to be this purpose driven, certainly at Guide now, the fact that I've kind of got to a point where I get to make decisions around what I think will create the greatest impact and create a place where people love working, and hopefully where all of our clients and partners know that, our intent and what we're always trying to achieve, we're always trying to do great things. That holds me in good stead. So yeah, just continue to be values based, continue to know what we're trying to achieve, and continue to make decisions that are, I think, from a place of care, and that are again sort of values based and driven towards creating a great place to work and great impact. So yeah, I don't know. That's maybe where I'm at.
Nah, thanks. I almost feel like they're, byproducts of Guide, almost trademark products, purposeful engagement and meaningful interactions. But I think, you're right. And we've covered a lot. That's been, quite a comprehensive overview in that short segment. But look, I really wanted to say thank you for your time today. Appreciate your time, Simon. And also we will be dropping a trailer of this soon. What's the cutoff point for any aged care facilities that want to be a partner of Guide? What's the cutoff point for the Powerlympics? What's the cutoff date?
So no cutoff. You can join anytime throughout the course of the events. They are individual events. So like even if I was joining last week and they've got a gun rower or an insane long jumper, they can join. But even, to be honest, beyond the Powerlympics, if people are looking at, if providers are looking at this, or homes are looking at this event being like, cool event, but we already have something going on, we don't mind sending out the resources at a time beyond the event. So the posters and the, access to leaderboards and stuff, like we can send out generic versions. And we've always done that. And it's really just because we love the idea that these events are actually impacting beyond our little kind of circle of community, I suppose. So yeah, no cutoff. Anyone can join. Flick me an email, or reach out on LinkedIn, or give me a call, and we'll get you signed up and ready to go.
Perfect. So I really appreciate your time today, and for sharing these pearls of wisdom with our audience. Look forward to, no doubt, talking to you soon and seeing what innovative things you're doing at Guide. And yeah, thanks for your time.
Nice one, Mark. Really appreciate the opportunity. It's been fun.
Thank you.